hosting today's Digital Health Roundtable. The structure for our session, I'm just going to, I'll spend more time on explaining the role of TM Forum and GIO later. For our roundtable, we've got it's broken into two sections. The first section is focused on a very specific topic on trusted data for emergency management and the potential to be able to take learnings from existing projects to explore how we can create a common framework for application of trusted data for different types of emergency management situations. One of the biggest issues with trusted data is obviously the governance aspects and how you can apply this in different ways in different regulatory environments around the world. So we'll be focusing on that particular topic for the first hour with a view to understanding or coming to a conclusion on a way forward or a practical project that we could do running in 2021 and demonstrating towards the end of the year in 2021. That way, we're bringing learnings from lots of different avenues, focusing on very specific topics, trusted data for emergency management, pandemic management, and others. And then in the second section, you might think this is probably in reverse order, but it was due to logistical reasons I had to structure it this way. So in the second section, we'll actually be taking a much broader view towards digital health, the role of ICT in enabling digital health transformation, how we bring the different communities together. And it is in that section that I will give a little more deep dive into who TM Forum is, who our members are, what we do, and the role of GIO. But essentially, GIO, to get us started, GIO is a platform for sharing. It's where we bring many different organizations together to share best practice and knowledge, frameworks, methodologies, etc., so that we can share our learning, reduce the amount of reinvention of the wheel that's going on around the place, and basically harmonize. It is really harmonization of methodologies and tools and techniques that will enable the degree of scalability and reuse and reduction of costs of innovation. That is what we ultimately need in order to achieve the global ambitions of SDG 3 and digital health transformation. So the collaboration is really the focus for the second part, and then looking to have a broader conversation around the role of ICT and telco to enable digital health and how and where we can collaborate, where it makes sense for us to collaborate and agree a roadmap going forward into 2021, where we can benefit each other as part of the WHO network of networks. So we can bring this community, how can we support other communities? That's it really, just to get us started, to give you the context. And before we jump into each person introducing themselves, because it is a round table, it's intended to be informal, it's intended for people to share their views, interact. Just to give the governance structure for the session, it's operating under Chatham House rules, which means that in the meeting you can speak freely. People can refer to the content of the meeting afterwards, but they would not refer to attribute that to specific people or organizations afterwards. Okay. So to get us started on our event today, I have invited a team of people. This group is called the Trusted Data for Emergency Management. They're an award-winning TM Forum Catalyst project. Catalyst projects are rapid proof of concept projects. We run them over a very short period, like 4 to 6 months maximum. And in that period, the team will scope, design, develop and deliver their project. They will use industry best practices as much as possible. They will also capture learnings that feeds back into standards and best practices retrospectively after the project. And we are delighted to have Fan Yang and Yang Zhu here from China Mobile and China Telecom respectively to present their project, very interesting project, which sets the stage for a conversation then on the potential role of trusted data in the context of helping to manage emergencies and pandemics in the future. So over to you guys, and just check this. I'll share the screen for you and move the slides for you, and you can just ask me to move and I'll intuitively see it. So over to yourself there, Fan Yang.
Excuse me, Diane, would you share your screen?
Is it not moving on? I am sharing, but is it not moving? Okay. Okay. There we go. We'll go do that again.
Yes. Good. Yeah, it's
apologies for that. Thanks, Kevin. And we'll move on from here.
Yeah, probably you can play mode. So
okay,
so
I can see it moving now. Lovely, thank you.
Yeah. So Zhang Fan and Zhang Xin, would you present these slides? Hi, Zhang Fan, we cannot hear you. Excuse me, Zhang Fan. So Zhang Xin, can you hear?
Yeah, I can hear. It's fine here.
Yeah, we can hear
fine.
your voice.
We can't hear you.
Okay, can you hear me?
Yes.
Oh yes. Yeah. Now it's good. So
yes, the internet is not that good.
Okay. So are we able to?
Okay, so can we begin?
Yeah. Yep.
Yeah.
Yes, please.
So Zhang Fan, we again lost your voice. So Zhang Xin, can you hear? Zhang Xin, can you hear?
Yeah, I can hear. Fan, I suggest maybe you can close your video and only the voice. I think maybe that will be better.
Yes. So Zhang Fan, can you turn off your video?
The function is not connected for audio, so we need to move to the next option. So can Zhang Zhu cover the presentation, please?
Zhang Xin, would you mind if you give the quick introduction for this slide deck, or how do you think?
Can you guys hear me?
Yeah, I closed the video. Maybe
hello.
It would be better. Is that good? Yeah, I can hear you.
Yeah, we need to present.
Yeah,
so are you okay to present, or will I move it over to Zhang Fan?
Fine. Can you hear Joanna's voice? Hi, Fan. Maybe I can give a quick represent about this. Is that okay? Hi, Fan.
Yeah, please.
We need to present, guys. Yeah. Thank you. We need. Yes, please.
Okay. Actually, about this catalyst, this project is led by China Mobile, China Telecom, and China Unicom, and together to build a trusted data sharing platform during COVID-19 pandemic in order to assist the government for smart public health emergency management. And that's the name about this project. And through telecom operators like to realize big value from big data, it is quite challenge for them to share their data, such as other enterprise data owners. First of all, the data owners is actually is not willing to share the data and information if their data rights is not well protected. Secondly, the data is classified with the level of the confidential. Telecom operators need to obey the law and order to ensure the privacy information is well to protected. Secondly, it's a lack of the technology for people to share the data efficiently with the protection of privacy and data rights. Maybe next slide. Thank you.
Go on, next slide.
Next slide, Joanna, please.
Yeah. Okay. So Zhangxin, can you see the slides? Actually, this is the slides
No,
9.
Your previous slides, not the next slide. You can see the next slide, right?
Actually, right now is the slides. Yeah, I can see. Yeah,
Page
the law
2.
regulation. Yeah, yeah.
Okay. I can go with the next one. So the data opening and sharing need to abide the law and regulation, even it is used to public health emergency management. And we think that we will need to build a reasonable coordination between data security and development, so that we can achieve a dynamic balance between public governments and civilized protection. On the other hand, we could like to make better use data technology to optimize the government of major public emergencies. And on the other hand, we shall also to guard against the personal information protection, to avoid unnecessary. That's these slides. Next one, Joanna, please. Okay, I can just quick move. So we need to approach to provide trusted data and sharing by addressing the 3 challenges mentioned before, through the rights, the privacy, and updating under law and regulation. In order to achieve this, that's something we need to talk about. The first one is in terms of the rights. Blockchain is used to protect the digital rights of individual and organization, and encouraging data calculation. And the second one is data virtualization and privacy computing work together to solve the issues and further ensure data security. Data virtualization aims to analyze and display some data. And the second one is in order to realize the ability for high quality real-time data, and the data supplier must to adhere to standards of data governance to ensure the quality of data. And that's these slides. Please, next one. The foundation for trusted data sharing, as we say, well, China Mobile and China Telecom and the China the telecom operators is to trying to make like we say is trying to make the China fixed tree and they are trying. We are trying to look for a solution on blind chain based data sharing to encourage the data calculation in their TMF Asia Catalyst project in 2019. All the words above have built the technology and business foundation to speed up the trusted data calculation and sharing during the COVID-19 pandemics. The next one, please. And this one is architecture overall, and we can see China Mobile Big Data Platform, China Telecom Big Data Platform, China Unicom Big Data Platform. We have 3 big data platform, and the 3 platforms they to calculate their own data in their own platform, but we use the blockchain and the data virtualizations and also the data hub to sharing data and sharing information to find the results about the people's information in the COVID-19. So the next one is the COVID-19 emergency management on data sharing platform, and the bottom up you can see the government the data calculation to aggregate data into a data visualization center from hospital, public security, and telecom industry, so that it can support the COVID-19 emergency management. Next, we are going to introduce 6 applications about cover of the COVID-19 emergency management. So we can see the 6 applications. The first one is regional risk control, and the second one is the national health emergency, and the third one is the risk analysis service, and the vulnerable crowd care, and international traveling advice and assist to reopen business. And the 6th applications, what we do is to help our country to against the COVID-19 and make all the people to they can go back to work and without any risk. That's what the 6th application do. So the last one is a filter, and we are trying to use this kind of information, this kind of data with our blockchain and our fundamental stuff to use the different technology to build a trusted information and trusted data system to sharing our data and to create a trusted data sharing the system to help us to against the disease like the COVID-19 and to make help us to help us to protect the emergency emergency management. So I think that's what we want to represent. Yeah. Hi, Kevin. Can you hear me?
Yeah, Zhangxing, I can hear you. So, any more slides, or you finish? You brief all the information. So okay.
Yeah, actually I have already finished the represent, and because my network is also a little bit large, I can see the slides is architecture overall, not the last slide. So
okay. Thank you, Zhangxing, for your introduction. I think this case is brilliant. So, Joanne, so
that's wonderful. Yeah, so it gives us a good sense of what you guys did. That's fantastic, and I mean it's very impressive that you managed to do that in such a short amount of time. That's really good. So the next item is I want to invite Christian Metra to give his observations based on the project, particularly from a data governance perspective. So Christian is one of the CIOs at Orange Branch Telecom, and is has been leading in many of the initiatives that go beyond connectivity with Orange. He's also one of the leaders of our data governance work inside TM Forum, and Orange has been very active in the area of mobile trusted data for emergency management situations for a number of years. So I wanted to hand over the floor to Christian at this point to gain your views on whether it's feasible or possible to extract a common governance structure that could potentially be used around the globe for mobile data, but aggregate with other data as well, for emergency management situations. Christian?
Yeah, thanks, Joanne. So do you hear me well?
Yes, lovely, thank you.
Okay. I shut just down my camera not to have too much bandwidth on the usage. So if you need me to be online with the camera, just tell me. But if it's I would prefer not to have the camera. So yeah, so my name is Christian Metre. As you said, Joanne, I'm working with Orange for a couple of time, working with you, the TM Forum, and other VPs in the TM Forum for many catalysts and also for some good projects. And now I'm leading a project called Data Governance, which is one of the good subjects for today. And we will produce next year, beginning of next year, a white paper. And what I try to do here is really to take some input we have from this white paper to you today to talk about this global vision of data governance in the case of a health crisis and global governance. So maybe we can start with some definitions, because in the group with the project, we also had some, let's say, misunderstanding sometimes about data management and data governance. So it's to be clear on that. So very obviously, data, it's really all the elements, qualitative and quantitative elements that today our information systems are handling. It comes from the outside, sensors, your connected objects like the watch, your phones. It can be also coming from any import of financial, commercial, physical data coming from your government or your companies. And it is also the results of calculation. That's important to understand that data is not only the first part, which is coming from the basic sensors or the basic things. So managing the data is everything about ensuring how you acquire it, how you store it, how you can access to it. So managing data is really functions that operate on top of the data. And the data governance is really how you organize the way you do this management, how your strategy is about this management, how the strategy is across your organization, with the outside of your organization, with your country state, to fit your business, to fit your goals. So it talks about why you do it, what level of management you need, how you will organize the reviews, the release of the new versions of your governance, and so on. So it's not functions, it's really strategy. So governance may be of different kinds. Let's say the company side or the public side. So I think it's not to be separated completely as it was in the past up to now, up to the COVID-19 crisis, where in fact companies were building their own strategy on the governance for themselves, for their own business, and countries were developing some agencies that were creating some big rules on top of the data, of the privacy of your personal data. So for the company side, now I think it's obvious, but each company must define this governance, this strategy, the vision on how it manages the data for its own business. I will give some example after that. We have a lot of good companies like McKinsey, Gartner, TM Forum that today are providing some frameworks to organize this governance building. Governance is like building a binding structure across all the sectors of the company to organize the journey of the data inside the company. So it's working on how the commercial data works with the HR data, works with the production data, works with the traffic data for a telco, for instance. How can we implement the rules also, and how can we change the rules with the context of the situation, for instance, the sanitary situations? It can start to be really, really complex in big companies if you don't have standardized this governance, the links between the different sectors. And in many companies today, the data governance is really as simple as in our company, we need to have a simple system of data management to protect our own data. And then guys in IT, in management, in marketing, in sales, please do it yourself, organize yourself to protect and to organize the data. So it's not that easy, to be clear. And it's really today, still, even with the COVID-19 period, not that in the mind of the C-level people. It's really a problem of C-level. If you want to have your company to be safe following a big crisis, in the case of pandemic, you need to have your C-level really aligned with some kind of a data management. And for instance, just good examples. When you are customer of Amazon, Facebook, and Google, you sign your opt-in with the option of you let these companies use your data, whatever they are. So you make a lot of input in your apps, and then they use your data. Do you think that inside these companies, the data governance is the same at the same level? Do you think that they allow data coming from the R&D departments are able to be shared all over the company? So really, it's really important to understand that data governance inside company are today absolutely mandatory at a good level for the business of the company. On the public part, which is quite interesting for today, we see more and more states publishing governance frameworks, which are all specified for their own purpose, for their own culture. So in the group of the project for the TM Forum, we had people coming from Europe, South America, North America, Asia, Middle East, and we really understood that coming from different countries or the different continents, the vision of the culture is really important on the public governance vision. So it has to be taken into account when you want to really create something more global. So today, in the majority of countries, what they did, in fact, they create an agency. This agency creates a governance paper which specifies internal rules inside the country, how you need to export, import. Are you allowed to do that or not? With other countries, within the countries, with your commercial companies, with your public organizations. And then that's all. It means you are fixed in a framework which is for your country, for that moment, and doesn't really give a vision of how you can change it, how you can adapt it when you have a moment like the crisis for the COVID-19. GDPR, for instance, is a good example where Europe has been organizing a set of rules about securing your personal data privacy. But there are some parts in the GDPR that talk about flexibility, changing it, but it's really not that easy. So in each country today, almost every single country has its own model. Not too far from the other ones, but not compatible at all. For instance, in Europe, Estonia has made a very good one work. Estonia is one of the really advanced digital countries in Europe. Everything is almost digital, so no more, let's say, physical money. Everything is digital. They create something which is called XT, XT. And their goal is to create a federated model of data to enable public services. It means that they understood that if you govern the model of the data as a federation of things, you are able then to publish APIs, that is the case, and then to create services which are quite flexible and that enable really the improvement of the country's public services with a lot of real good achievements. So that's a good example to follow. And in any single country, you have a framework of this kind of data governance. As I said, more than being compatible, more than being compliant to the internal countryside rules, the problem we have with the data governance that are today in place is really how can it be made flexible, agile, when something special appears like COVID-19. So COVID-19 is a good one case, and I will make this as an example. In my company, as well as in many companies, telcos and others, we had a long discussion with Joanne on that. So during springtime, we spent hours, days discussing between the telcos, between the statistics official agency in France or in many countries where we are implemented, and the governments to see how we can share our information, their information, to help fighting the COVID-19. For instance, to create the application about contact tracing, the government does have the right to impose geolocalization of people to enable a better tracing. Can it impose the record of list of contacts somewhere or even anonymized? Well, to be honest, it's still under discussion because the rules in many countries says no way, you cannot impose that as a government, in Europe mainly. In some countries, like I suppose in China or in other Asiatic countries, it looks like it's much easier. So again, difference between the way the culture can adapt the way we use this sharing of data. So we are still spending time today to see how we can share the data that we use, for instance, to create some graphics in terms of migration of people cross borders, migration of people from big cities to countryside, migration of people and correlated with the epidemic flows. So we have some mock-up on that, but it still is mock-up because today the question is it legal? Is it ethical? Is it moral to allow a government to get all this information on you? And is it a freedom killing process, or is it a better way to have a better health with this kind of pandemic? So the WHO has provided good input on that about ethical things, but it's still high level. It's still something that we are today thinking about, but still governments doesn't do not want to go to this kind of vision of sharing data for better health, a better understanding of pandemics and so on. It looks like it's very complex in many of the, let's say, more Occidental countries.
Okay.
It's not question
Sorry,
about.
Christian, to interrupt. We're way past time, so I'm going to have to interrupt on
Okay.
you. So thanks for that context. That's great. So where we are really now is that we've got a sense of some really good projects that have happened in the data space, but what we really need to hear from is people who need to use the data and are keen for technology and healthcare to work together to solve these problems. So I'm going to hand over to Denis Gilhooly, who is the founder and CEO of Global Health 2030 Innovation Taskforce. So Denis, from your perspective, tell me what it is you need from technology companies and the health companies to work together in order to solve the challenges that you see that need to be addressed.
Good evening, Joanne, and congratulations for putting this together. It's extraordinary, and it's a privilege and a pleasure to be involved in the GIO. I'd just like to say the last two presentations, Christian, that was really cool, and China Telecom, what a super presentation. I mean, you kind of knocked me off my feet, but I'm not surprised because I am actually in Beijing, and at the beginning of the year, I visited WHO China, and they did an analysis on all of the interventions just as the pandemic actually started. And as Christian alluded to, the privacy issues in China are not quite the same as they are in France or Germany or whatever. And they have actually, I mean, they delivered, all of the mobile companies delivered, they were asked by the government to deliver brilliant applications in terms of tracking and tracing, in terms of traffic lights. So you cannot walk around Beijing, guys, without your mobile phone walking into a hotel saying whether you're COVID-free or not. I mean, this is extraordinary. If you compare this to the catastrophe in the United States, where the system has failed, let's be straight about this. The entire health system in the United States has collapsed, and we are suffering right now. And I know Verizon is they're trying to do what they can on this, but we have to move forward in a way which is a game change, essentially. Now, back in 2016, and the speaker following me is James Hospitalis, who's an extraordinary doctor who launched the Caribbean Association for Public Health in across the Caribbean, and he's now he'll tell you what he's doing right now. But I was in Trinidad and Tobago, and what we were trying to do was to see how we could actually match what the mobile operators were doing with the ministries of health, because there is suspicion, and this is all about trust. There is suspicion between the private sector and the public sector, and there always has been, particularly in terms of data governance and the sharing of data. Okay, now, when a pandemic arrives, what does it actually mean? What we are seeing with COVID is the merger of a great influenza pandemic, which we haven't seen since 1918, with an attack on chronic non-communicable disease, which is heart attacks, stroke, hypertension, diabetes, all the non-communicable diseases. This pandemic is actually attacking. So it is debasing all of the health systems around the world, and we have to move in another way. Back in 2016, I was working on Ebola with David Nabarro from the World Health Organization, and we came up with the idea of the mobile action on pandemics, which we presented to the Commonwealth of Nations Health Ministers meeting in 2016. And MAP was Mobile Action on Pandemics. MAP was approved by all 54 health ministers and still is. So we're resuscitating this project now for the purposes of the current pandemic and moving it forward. But it's a different environment now. And remember, we had Zika as well. So James can talk to Zika because that actually affected the Caribbean and Brazil in a way which was quite heinous, and as we know. But Zika is also a symptom of climate change. So we have to look at mobile as ubiquity. Mobile essentially is the only thing which can actually meet a pandemic because it is real time and because everyone's got a phone. And this is just extraordinary, even in Africa, right? So how do we actually sort of use mobile data and the movement of people to confront the pandemic moving forward? So we're looking at systematic change. My job right now is, some of you probably know me, I launched Communications Week, the newspaper, in Paris, and Christian, je vis Paris depuis longtemps, pour 10 ans, en Paris, alors, j'adore la France. I love France. France is great. I lived in France for 10 years, and I put a newspaper there. And after that, I worked for Bill Gates. I worked on Teledesic, which was the satellite project to bring broadband access to the whole world, and then moved off to the World Bank and then the UN and launched the Broadband Commission and UN Digital Health Initiative. But the point is, we have to actually think completely differently now, Joanne, about what we are doing in terms of this greenfield space, because digital health is a huge industry. What we have seen in the last 9 months is essentially an acceleration of digitalization on a global scale. Obviously, it goes to retail as much as anything else, you know, it's across the board, but it will be the transformational moment for healthcare on a global basis. Our health systems have failed us, and that goes for the UK. I worked in the national health system. I was a psychiatric nurse. That was my first job before university when I left Ireland. And the NHS is basically on the verge of collapse. We've seen bright spots. Germany has done rather well. You know, some Scandinavian countries have done rather well. But in general, this pandemic is not over. I actually believe it hasn't peaked yet. And we have to be on our guard. But us as technology people and you as private sector people have to now come to meet with the public sector. Now, this is the sort of the last point I'll make, Joanne, because I know time. Yeah.
Yep.
Is that the incentive structure for the private sector to actually engage in this area is not set up. And Denis O'Brien, who runs Digital, he runs all the networks in the Caribbean and in the Pacific. He's just not interested in getting into health, or he wasn't until he actually is now, because we spoke yesterday, and he's very, very interested in what you're doing, and he wants to connect with you, particularly as you're also called O'Brien. And I'm sure you're not related, but you know, whatever. And he's probably richer than you. But the point being, Mobile
the
companies,
incentives, yeah.
mobile companies, if they actually engage in data, they're going to get into trouble. So we have to actually architect a system where the mobile companies are at ease in working with governments and ministries of health, but not just ministries of health, ministries of ICT and ministries of finance. So we have to connect all the dots between these guys, pull them together, and move forward. I'll finish there.
That's a great point, Denis, because I feel many times when in some respects, when privacy regulation came in, I mean, you do GDPR in Europe, but you have privacy regulation pretty much everywhere on the planet. When it came in, companies put so much emphasis on protecting the company, and the spirit of the privacy regulation was missed. And the spirit of it was that please put the structure in place so you can share data effectively and in the right way with the right governance. Whereas what people have, the resulting behavior has been more towards let's not share data, which I think is the wrong outcome. It's about let's share data appropriately, effectively, in a safe way. So I think we need to bridge that gap.
In terms of moving forward, Joanne, right? As you know, we've both been working with the WHO on these series of roundtables. The next one on the private sector will be in January. And I really want to invite Huawei, China Mobile, and China Telecom. I'd like to involve GIO in this in a big way, right? Because I think it's a great industry forum that you've created. But we're going to deliver in January, and we will launch the Mobile Action on Pandemics 2030. And I have complete backing from the Secretary General of the United Nations and the Director General of the World Health Organization moving forward. And we'd like to team up with GIO moving forward.
Excellent, Denis. Thanks very much. That's really good news. So we're going to move on in the interest of time. So the next presenter is Dr. James Hospitalis, who is, among many other things, he's going to talk to us about, he's the CEO of Earthmedic, and he's going to talk to us about the potential use cases that he sees where the application of trusted mobile data could be used. So James, can we hear you? Oh, there you are.
Hi there.
Hi, James. Hi, I'll hand over to yourself, and then just to give some context to people on how we're going to shape up this, we are gone over time. So just to address that, we'll give James his 10 minutes, then we'll have a short conversation about how we can move forward with mobile trusted data, and then we'll move into our second part of our conversation. Okay, just for people who are managing their time. Thank you.
Thank you, Joanne. I'll jump right in. Good morning or good day, everyone. I've enjoyed the session so far. Great group. I'll go very fast through the first couple of slides and slow down on the challenges and use cases, and then speed up again because of time. So this is my opening slide about planetary health management. I started with a quote from the Bible about the earth being good from the perspective of God when it was made. But we humans are really not being very good stewards. There's a lot of the challenges with climate, the challenges with COVID, chronic non-communicable diseases are among them. Next. The big challenge is, as probably everyone knows, is this problem that fossil fuel use is causing the whole Earth to heat up, particularly in the oceans, and this has a lot of bad effects. Next slide. So you can read up all about this. So a summary of the sort of how climate is impacting on human health and why we need to cooperate in a way we have never cooperated before. Many people speak of building back better, and I talk about working better together to build back better. Next slide. Again, another slide showing a mixture of outrage, all the catastrophes that are happening, the fires, the floods, the hurricanes. 2020 was an absolute record year. and some of the things that are good. Now, here are some of the challenges. I'm going to slow down a little bit on this. Ignorance, fragmentation, epidemics, data silos, extreme weather, and you might have your challenge to add to this list. So let's start with awareness. The issue of climate change and what can be done. There's widespread lack of awareness, not only by citizens, but by health professionals. Health professionals are aware a bit about climate. I've looked at some studies from several countries recently, but have no specific knowledge of or little specific what to do. When you look at fragmentation, many countries are waking up to climate and health. The International Council of Nursing, the World Medical Association have all come out with strong position statements to influence their 50 million members around the world, but it lacks specificity in what can be done. Third is the new epidemics, of which COVID is an example. COVID is a wake-up call in planetary health. It emerged from a forest, it spread around the world with international travel, 1 billion international travel arrivals per year, and it's having the bad impact that it is because our population is not very healthy with the high prevalence of diabetes, hypertension, etc. So there's scope for mitigating the impact of catastrophic COVID. The other aspect of COVID is the spread, which the China presentation was very interesting to see how this could be applied elsewhere. Data silos. This is a big challenge. Health data are often respiratory illness or gastroenteritis is collected separately and is not analyzed together with environmental data such as air pollution or water quality. Finally, extreme weather. The world is experiencing more and more extreme weather and populations are being displaced. Central America, the Caribbean, North Africa. If you look at the Caribbean, we have a particular challenge right after the big storms where people have to move and it's very chaotic, but I think mobile phone and mobile approaches can help. You may have your challenge in this area. Next slide. Now, how to solve these? They all require trusted data. Digital is the only way. Digital is the only way we will get the speed and the scale of change we need to save this planet. On environment, we propose a campaign for health warning labels in fossil fuels, where folks can support us with texting, free texting across national boundaries, with the goal of raising 100 million signatures before the COP26 in Glasgow next year. To address fragmentation, we're proposing an Earth Medic Earth Nurse pledge campaign, which is aimed at the 40 million nurses and medics globally, to try and catalyze action to improve health of self, society, and planet. And that pledge is a 15-second pledge that binds the individual to what their country or their association has said. I believe for COVID-19, we can mitigate catastrophic COVID by scaling up population control of NCDs. Currently, it's probably around 25% in many, many countries, but that could be tripled using a 90-90 approach, where you try to diagnose 90% of the folks with the problem, get 90% of those on the treatment, and get 90% under control. The second part is to help with the spread in and between countries. Some of the tourism economies have been hammered because of lost revenue. And if there's a way a smart partnership could help, say in the Eastern Caribbean, that would be really saving not just lives, but saving the whole economy. Data silos. We would like to expand the local environmental observation network, which is a global network, to include more nurses and medics and analyze joint data. And finally, extreme weather. Populations have to move very frequently after a big storm to go to school, to go to work. How could we facilitate the management of those displaced populations using mobile and digital? And you may have your case or interest here. Next slide. The following slides are just quick examples of how or, I saw this in the China presentation and I wanted to, can you go, yeah. Before a major epidemic enters a large city, how about if we had a system that kept track of where forests are being destroyed? You see, most of the new epidemics to emerge in the last 30, 40 years have arisen from forests and animals. And an early warning system that combines data on forest destruction, like the Norwegian government's Planet.com, with syndromic surveillance data might provide a benefit even before the first case appears in a big city. Next. Next. This is something we did back in 2011 to raise 500,000 signatures to push our heads of government to go to New York. And the digital providers supported us with free texting and with text blasts. Can we do this globally? Can we raise 100 million, 1 billion signatures to impress upon governments and everyone how important this is? Next. The next slide just data on treatment of diagnosis, awareness, and treatment of something like diabetes. And if 100% of people with diabetes are here, then how many actually have the diagnosis, how many are on treatment, how many are under control? The cascade looks like this. And every step is an opportunity for digital partnerships to improve awareness and control. Next. This is from work that you did, Denis, trying to put the mobile phone penetration. This is Trinidad and Tobago, where there are more than 2 phones for every person who's eligible to have one. So lots of scope for working on this. Next. I think I better stop. Oh, I do want to look at this. This is an analysis from the Partnering Initiative in the UK that looked at a number of rapid partnerships that were struck as a result of COVID and looked at the factors that led to the partnership happening. And I think as we move forward with digital health and look at the possibilities for the common governance, these are some of the lenses that we might want to look at. But what we're trying to aim is fairly simple and clear. It's a common good, etc. Next. And this is who we are at Earth Medic and Earth Nurse, striving to become trusted advocates for improving planetary health. And our top priority at the moment is the mobilization of health professionals. Next. Our vision, to raise attention to and resources for action to improve planetary health, working with an informed and empowered workforce through public, private, people, planet partnerships. That's 4 Ps. Next. I think that's it, Joanne. I think it's finished.
Yeah. Okay. Thank you, James, for that. So big, strong message there that, it isn't just about health. Health and climate are inexplicably linked to each other, particularly when you think about the context of pandemics and emergency management. So I think we got a good flavour there from Denis and James about if we are to look at, there was a lot of different responses to COVID around the planet where different regions took their own approach. And really what we need to do is harmonise a common approach so that there can be a degree of consistency while still obviously recognising the need for a regional application. So what I'd like to pose to the audience is for anybody to comment at this point. I mean, I'm interested to get any comments that people might have, any questions people might have, but also propose. What I'm looking to suggest to people that TM Forum runs what we call proof of concept projects. And the first project we heard from by China Mobile and China Telecom is really to take the learnings from that project and other instances of similar trusted data projects to see if we can apply that in other instances, in other geographical regions, so that we, in doing so, we start to test and derive a common framework for the management and sharing of trusted data, because ultimately that's what we need. We need frameworks for sharing data in a that meets the regulatory environment, that helps, like I think it was Denis said, that there is a lot of hesitation from private sector with regards to sharing of data, because there is a risk, right? People are afraid because there is a risk. and we need to understand what those risks are, and we need to reduce those risks. So I'm really interested in people's view. What do people think? Is it feasible to actually create another project spinning out from the China instance to look more globally at the common framework for data sharing? Anyone like to comment on that? Okay, everyone's shy because we've actually a lot more people on here. So I'm going to say James.
Joe, I would offer mobile action on pandemics. So WHO is trying to figure out how they can work with us because they have difficulties in working with the private sector, as you know. Yeah. And that is the sort of next stage of where WHO is trying to move on digital health. But I would offer to GIO, MAP 2030 in cooperation with WHO and ITU.
Yeah, so I mean that's a great point actually. So it probably is difficult for the organisations like WHO to engage a private sector on an individual
Joe,
basis.
you've got to realise their constituency. They report to the ministries of health. Okay.
Yes,
and
indeed.
That's basically the bottom line. So that's, they can't deviate from who they report to. James, I mean, you know this better than I do, but James.
Yeah, no, I agree, Dennis. That is the art and the challenge of what this is all about now, to get folks to the same place. And maybe you don't have to hand over all your data, you just have to have it interrogated to answer a specific question.
Yeah.
But you can see, from the China mobile presentation and the Orange presentation, that's where the brains are, I mean.
So maybe Christian.
Yeah.
Are you
maybe
still there?
because,
Can I ask you to comment on that?
Yeah, because just to comment the last comment from Denis, my presentation was more about not only Orange, but really the work we do with TM Forum. So it's a mix of different point of views coming from all the different countries, and so it was some examples from Orange. So my understanding was also to see how can we mix the work we do with this project we have started this year in TM Forum about data governance, to see how we can implement some good points. We have a one chapter called COVID-19, ethical, moral, and the rest. So it's something that we can work on that together, just to see how we can come from the purely company side vision of data governance to the global picture that is useful and mandatory, I should say, when we have such a crisis situation.
Orange, Christian, it should be stated that your footprint in Africa is very significant.
Yes.
And in Francophonie, yeah. And,
yeah, not only, yeah.
Yeah, and I'm also working with Sunil Bhatti Matel, and obviously he's, that's the rest of Africa and also India, and he's on board, directly. Mo Ibrahim is on board, even though he's just a foundation now. Dennis O'Brien is on board. So it would be great to hook up Orange, and also Telefonica is on board. So I think if we get the major players on board, and then we can start talking to, the head of the WHO and the head of the UN, we can move it forward a bit.
Okay, very good.
Yeah, agreed.
So I think where we're concluding is that while there are many, many challenges, there is a high degree of motivation to help solve these challenges. And that really what we want to do is find the right vehicle to explore and look to solve these challenges as we move into 2021. So I think the fact that we have
one last thing, Joe. Working in Trinidad with James, the minister, Terence, he gets it. And what we're actually seeing more and more is that these ministers of health are actually starting to get technology. And it's kind of a paradigm shift, to be honest. James?
Yeah, I think Terence was one of those who got it, as you say. When we look at willing and able and daring, some of the economies here are in such difficult straits with climate and with COVID that people are willing to try risky things.
Yeah, yeah, and I think, yeah. Hello, yes.
Hello, Joanne.
Yes.
I'm Haiping. So
Hi,
I think
Ping.
discussion is quite interesting and very good. So for this discussion topic for the trusted data sharing initiative, they have the framework and also should based on the different kind of projects. I think maybe not only based in China by China Mobile and China Telecom. I think maybe from Colombia, from Africa, from Middle East. So different. There are many telco operators. I think can form in our GIO environment. So whether they also can have some contribution on such kind of trust data sharing projects, then can let this initiative and framework can be more confidence, more convinced.
Yes, I agree.
Only based in China, I think it's not enough. Yeah.
Yeah, so that's what we were suggesting, is that we take the insights from the China project and then look to bring enough partners from around the globe so that we have a common framework for global trusted data for pandemic management. Okay. So I do think
yes.
sounds like we may have enough of the right people, and I think the action here is for us to document the suggested proposal and then leveraging Denis's initiative on mobile action on pandemics, leveraging the learnings from the trusted data sharing catalyst, the insights and use cases from James, that we put forward a proposal that we can share to other telecommunications operators, particularly engaging Orange, Christine, your colleagues in Africa, and Digicel maybe, and another.
Telefonica has as well, and Bharti Airtel, and
yeah, brilliant. Okay, I think that's really good progress and great insights here, and also very good input on the chat window. So if you don't mind, I would like to move to our second topic now, if that's okay with everybody. I think we reach a very good conclusion there to move forward towards a global initiative. And thank you also for all of our presenters on that, and particularly to the amazing team, the Trusted Data Sharing Catalyst team, who did amazing work in just 6 months. Incredible. So for our next section, because we're moving into the broader topic of how we bring together our two communities, the community of technology, ICT and telecommunications, and also the global health community. I want to just give some details about GIO, who is GIO at our terms of references, and who is Team Forum and what we bring to the table, and then we move in, have a presentation from WHO and then we can have a conversation around the best places to focus, because mobile data and trusted data for pandemic management and emergency management is just one aspect of the much bigger digital health strategy conversation that needs to be had. So global GIO is a roundtable. It's an environment for sharing. It's not even a legal entity, and it is this way on purpose, so that we reduce the amount of reinvention of the wheel. We share best practices and knowledge. It is our platform for essentially the network of networks. It's our way to communicate to lots of different organizations, and it's still a relatively new concept. It's building up, and we welcome more organizations joining this group. If Haiping would like to say anything, we can certainly do that here as well, because Haiping is actually the chair of GIO. This gives you a flavour of the number of organisations and the breadth of organisations. So very much still at this point, communications, ICT, lots of standards bodies. So really it is about the best practice and standards to accelerate digital transformation. as captured in the first slide. And TM Forum, I am TM Forum's representative in GIO. So give you a flavour of who TM Forum is. So we also are a global but we are a legal entity. We are a global not-for-profit industry association. So our model is, we are a membership model. So companies join TM Forum. And all of the best practices and standards that are developed by TM Forum are developed through essentially a form of secondment of the intelligence coming from those member companies. So they basically feed the knowledge, but also feed the infrastructure to allow us to share our knowledge and basically allow for global communications to, as an industry, move forward. So you might say, how does that even work? You know, you have competing companies side by side, sharing and helping each other. Yes, because as an industry, we all need to move forward, and it's about understanding where it makes sense to harmonize and consolidate around common best practices and understand where it makes sense to differentiate. And we think of that architecturally often. We can go into that in more detail if anyone is really interested, but there it makes an awful lot of sense to drive down the cost of R&D, to use common repeatable patterns for things. We deliver our value to our members in different ways, through informs, through events, through communities, with online user groups where people support each other on the application of the best practices and standards. We've mostly two types of projects. We have collaborative projects which build the knowledge base of white papers, best practices, standards. We have labs where people can test these things out. You can expose code and very quickly and create proof of concepts. Part of the reason we can do proof of concepts in under 6 months, and usually more of a 4-month sprint, to be honest, is because we're underpinned by standards and we can interoperate much faster. It's more a case of getting past the motivation, understanding the scope, and then doing the build. So we have all of these technologies and tools which are built with all of our members in place. Our core set of assets is known essentially as the Open Digital Framework. It's a set of assets that allow for digital transformation of IT and operations, with the assumption that it's to be cloud-based, modularized and cloud-based. And we run clearly training and certification and benchmarking. This is a view of the best practices and standards portfolio. It's a pretty massive set of things. It's underpinned by the foundational libraries. So things like information models. You know, we have a massive library of information models which capture the modeling of any entity, any type of entity, and we harmonize this right across our industry. And it is these kinds of underpinning libraries are the reasons we can interoperate. We have libraries of APIs which are standardized and exposed. We provide the code, the test, the conformance, the definition of how you extend them, how to use them in different practices, how to test them, and literally provide the code that people can cut and paste into their instances. And then people come to our lab and test that they're compliant. And these practices are the underpinning of interoperability at the IT layers of telecommunications right across the globe. Many of these assets, particularly the APIs, have been purposely designed to be what we call service and technology neutral. They've been applied in smart cities has extensively used our APIs because they're operationally focused. We also have tested them in manufacturing and healthcare and autonomous vehicles and things like that. But we'll get into all of that. It's just to give you a flavour of what's there, so that when we get into where and how we should collaborate, you have some sense of what's behind the face of TM Forum and the body of work in GIO. So then, one big feature, of course, on the minds of telecommunications is, 5G is on the horizon in many countries. It's already in a lot of countries as well. And it's not just another G. It is different. There are features of 5G that will create opportunities to do things fundamentally different in the future. And through collaboration and exploration and co-creation, can we really exploit that? From a healthcare perspective, use cases such as remote medical emergency response, robotic surgery and things like that have all at least been tested in lab-based environments. So the potential to do things fundamentally different in the future is there, and that would be certainly something on the minds of, at least I would imagine, the operators in the table. I've included here what it means about splicing, because it is a key feature of 5G. It provides you the ability to create virtualized networks and prioritize one service over another. So, for example, if you've got a remote medical situation going on, an operations capability can be automated to ensure that that gets priority, and the mission critical services get an applied network slice, and therefore will not have degradation of quality. They will then have the ultra reliability and low latency that is the key feature of 5G. So that's just a little flavour of who we are. Now I'd like to invite Derek to present upon his views on the digital health from a World Health perspective, and then we'll have discussion around where we can collaborate in the future. Derek, are you there? Just checking on Derek. I know you were there all along. I saw you. Hi, Derek. Are you ready to roll there? Can you hear us? Okay. So we have gone over our time slot, so maybe we were after running into an issue with Derek's schedule. While we're waiting on Derek, Denis, you're heavily involved and you're obviously consulting with the WHO, you're helping with the roundtables. Would you just explain the structure between the academia, the private sector, the network of networks? Would you mind just explaining that to people as I try to down Derek, please?
Yeah, Derek is he's in Brazzaville, I think. He's with the WHO Afro, and Derek he's just a great guy. If he can't join, I'm sure he can send his slide deck. What happened basically was in 2018. Okay, we got the resolution, the World Health Resolution on digital health, which was quite a surprise. It was unexpected, and it was driven by India. That led to the creation of the Department of Digital Health and Innovation, which is headed up by Bernardo Mariano, who's from Mozambique. And his boss is Sumia, who's the chief scientific officer. And they just got through the World Health Assembly about 3 or 4 weeks ago, the global strategy on digital health. There are 3 elements that they're focusing on. One is early warning and surveillance. The second is digital transformation of health systems. And the third one is the creation of a global digital health community network of networks. And yesterday we had quite an extraordinary meeting, in fact, of academia, which was keynoted by Jeffrey Sachs, who you know from Columbia University, right? And essentially, academia signed up to the network of networks, and then the final roundtable, we've had one for virtually every constituency, will be on for the private sector in January, and we will move to the co-creation of the network of networks moving forward. But this is just marvelous because, I mean, the thing is, you can't really do anything without the WHO, because then you don't have any legitimacy. They are actually, they're mandated to design global health. And as part of the United Nations, WHO is it. What is really marvelous is that Dr. Tedros is completely bought in on digital. And when I worked for Kofi Annan, you know, way back in 2000, when we actually wrote the Millennium Development Goals, he allowed me to put in digital at the forefront. And as you know, I designed the UN Broadband Commission in 2010. We do need legitimacy from the global organizations, because then all of the governments can come in and then they can actually work with the private sector. Sorry, I went on a bit, but you know what I'm saying.
Yeah. So that's fine. Look, I mean, Derek will come back, and thanks a million for Denis, because I did need to give people the at least the structure of how things are operating with WHO.
Yeah, it's moving forward in a way that I think is, you know, very, very good.
Yeah.
Hang on,
So,
is he here? Is he here? Derek, are you there? I've actually got his mobile. Do you want me to call him?
yes, please. And in the meantime, I'll just check on Lucy.
It's getting late.
Yeah. Lucy, you're there. Great. So we'll go to Lucy while we're waiting on.
Yeah, absolutely. Yeah.
Thank you.
I'll see if I can get hold of Derek.
Yeah, good afternoon, everyone. My name is Lucy Baker, and I'm the Service Technology Director in BT. And a large part of my role involves exploring early 5G use cases across the healthcare sector. So I've spent the last 18 months working closely with NHS trusts around the country, developing and working together on early proof of concepts. And this is very much a sort of co-creation type approach. And sort of being completely embedded within the NHS trusts. The one thing I wanted to share with you today was a specific use case that we've worked on with University Hospital Birmingham. So last year, when we launched 5G back in May 19, a couple of weeks later, we performed the UK's first remote ultrasound over the live 5G network. Here we were connecting a paramedic in the field to a specialist clinician at the hospital. And our paramedic who's with the patient in the field was performing a remote ultrasound on the patient. And as you can see in the top left-hand picture, he is wearing a haptic robotic glove. And the paramedic is guided by the specialist doctor back at the hospital. So as the doctor in the hospital moves the joystick left and right and forward back, that sends control signals over the 5G network and the haptic glove to vibrate, indicating to the paramedic where to place the ultrasound probe on the patient. A few months later, we then took that concept a little further and we developed a fully immersive experience for our clinician. Before, the clinician said, it's great, it's like having a long arm into the ambulance. I'm able to triage and diagnose the patient. But this time we wanted to give them a truly immersive experience. So we introduced augmented reality and virtual reality to transport our clinician into the ambulance itself. And so what you can see here is we had a 180-degree camera on the ceiling of the ambulance. And that 180-degree camera, the images of that 180-degree camera were sent in real time over the 5G network to the clinician at the hospital, who was then able to, see and be immersed in that overall scene in the ambulance with the patient and the paramedic. The images from the 180-degree camera, together with images of, as you can see on the bottom left and the bottom right-hand images, together with images of patient vital signs, medical record, the ultrasound scan itself, and also images from the augmented reality headset that you can see that's worn by our paramedic. So this is essentially an Android tablet on the end of a boom, and it has a see what I see camera capability. So voice controlled, it is able to zoom in on a patient, on a cut, a wound, and then again, those images are sent in real time over to the clinician in the hospital. And you may ask why were we doing this demo? This is all about trying to improve the overall efficiency. As we all know, there's a huge amount of stress on the hospital system at the moment, and particularly, now we have the COVID pandemic to manage at the same time. So we tested it with 2 different patients. The first patient being someone who was complaining of fluid to the abdomen, so suspect liver laceration, and the doctor was able to then diagnose, see the ultrasound scan of the patient, and be able to assess that patient, say, actually, we think it's a liver laceration. That patient needs to go to a specific unit to see a specific specialist. So it was all about sending the patient to the right unit at the right time to see the right person. The second scenario we showed was a person who had a cut to the arm, and it was a borderline case. Should that person go into hospital or should they not? And the doctor, from the close-up footage sent from the augmented reality headset to the clinician, was able to look at the wound and say, actually, you don't need to bring that person into hospital. So in that instance, it was preventing a conveyance into hospital and thereby reducing the pressure on the system. So I think here we've got 5G connecting a paramedic in the field back to that specialist clinician at the hospital. For the paramedic, it gives that reassurance and guidance, and also for the specialist back at the hospital to have that continuous view of the patient. It helps prepare the hospital team for that patient upon their arrival. Early this year, with obviously the COVID pandemic uppermost in all our minds, we also then worked on a solution. The hospital had come to us and said, look, what can you do in terms of helping develop a remote diagnostic capability that could be used in some of our Nightingale field hospitals that were set up around the UK, and also what could be used to help address the care of the elderly out in the community. So again, co-creating and developing and working closely with the clinical teams, we developed a remote diagnostic capability, which in essence is a set of digital medical devices, digital stethoscopes, ECGs, ultrasound, together with a See What I See camera capability to give clinicians, remote clinicians, the ability to see what I see from the patient's bedside. So there we were connecting health professionals in the field, and this extended beyond the ambulance now into nurses in the community, early intervention teams in the community, GPs in care homes, and connecting them back with specialists back at the hospital, back at the surgeries, but also introducing the idea of a multidisciplinary team around the patient as well. So, I think, a lot of what we hear, it takes years in some cases to train specialists in hospitals. And
All right, I'll keep an eye.
Interference on the line.
Sorry.
Okay, good. Bye.
What we feel is with like a connected ambulance type solution and also the remote diagnostics capability, we have the opportunity to start addressing this gap. Obviously there's a shortage of skill sets, but if we can then provide that reassurance and guidance by sending maybe less experienced people out into the field, but connected back to specialist clinicians at hospital, that can go some way in terms of helping also deliver that care out in the community where the patients are, but also to provide and enhance the collaboration and also improve the well-being of the staff themselves. And that's my piece, Johan.
Brilliant, thank you, Lucy. That's very, very interesting, very innovative. I certainly hadn't seen that before. Anyone got any questions for Lucy? So I'd like to understand, you were thinking about this. I mean, one of the biggest complaints when you get into digital health, Lucy, is the concept of pilotitis, the fact that there are so many isolated projects without them necessarily driving towards an integrated, holistic digital strategy. How did you address that in this particular project?
I think it's all about co-creation, and what I mean by that is that this is not just a sort of one-off proof of concept that we've done with an isolated trust. This is about building a long-term relationship with some key lighthouse trusts, whereby the first and foremost is actually listening to them. What are their outcomes? What are they trying to achieve? This is not about BT as a technology partner, developing something in a darkened room and then handing it over to the NHS. This is about us, you know, hearing what their outcomes are, developing these solutions together, and also work on that longer term digital healthcare vision and enabling them to deliver that. And the other final thing is around, actually, it's not just necessarily working with the hospital. A lot of this requires broader engagement across the broader healthcare community. So it's around, it's being embedded as one big virtual team, from the hospital, community healthcare, GPs, to care homes, to technology partners. And that's all being part of that program to develop that end-to-end strategy. But I think that to have that joined up approach is really important across the healthcare community.
Absolutely. Yeah. Yeah. Very good point. I mean, I do think co-creation is a big factor of this. Absolutely, because you want to bring the specialism, the deep knowledge of the technology with the functional knowledge of healthcare. Absolutely. Any other questions from anyone? Okay, I'll just try one more time for Derek. Yep. Oh, hi, Ping. Yes, please.
Yeah. So Lucy, I think you really give us a very good presentation and show the case about the connective imbalance. And I fully agree with you that should be the co-creation between the healthcare industry with the communication industry. But here, during the connective imbalance, whether the healthcare in hospitals or NHS system will have some requirement based on some standardization about the SLA in such kind of 5G network to guarantee such kind of the connecting can be have the good quality to deliver the right diagnosis or instructions, such kind of things.
Absolutely, I think so. And obviously, you know, we did our first proof of concept in Birmingham, which is a strong 5G presence at the moment, and it's about using those lighthouse trusts to then, you know, look at that broader picture across. But I think you're right that there certainly would be.
Yeah. So
okay,
have they been defined yet? They've not been defined yet, Lucy, no?
Not yet, no.
Okay, good. Okay, that's interesting. Very good. Any other questions? No. Okay. So Derek may come back now. He had warned me. He did have. I can see he's still there, but he is multitasking on another event or another meeting at the moment. So he may come back to us. In the meantime, we have, you know, we're incredibly lucky to have so many people from the health sector and also the ICT and telecommunications sector at this event here. So what we're really looking to do is understand how we can collaborate in the future, what our areas of priority should be. Excuse me. So key things that come to my mind really are on the things that enable interoperability, things like our data models and information models, harmonizing those, sharing even our methodologies for how we build up all of these libraries. Oh, wonderful. How we, you know, having a platform for sharing. Wonderful. Hi, Derek. I see that. That's great. Thank you. We will have Derek after all. Just one moment, so we'll get back to your section. But for the rest of you, you can be thinking about those questions, like the areas of focus for our collaboration. Over to you, Derek. Let's just check that you can hear us. You'll have to come off mute.
Hi, Joanne. Can you hear me?
I do, Derek. Thanks very much. That's great. So your slides are showing there, and I'll let you take it away.
All right. Thanks, Joanne, and apologies. The discussions have been very insightful on this particular call, and so I had to switch on to another presentation based on the time clash. And so what I just want to do is to, first of all, thank the different presenters, and so nice to hear from you, Denis. We were at the roundtable yesterday, and the people that have spoken before me have brought about very important insights. And so I just want to build on those from the WHO perspective. And again, because I'm traveling, I'm just going to switch off my video and then we'll switch it back on during the discussion. And so to begin with, the road toward digital transformation has received tremendous support from the global community. A number of people on the call have followed this particular path from the early beginnings, during the telemedicine days of the 1990s towards the 2005 resolution on e-health that brought in ICT into health and asked for collaboration with International Telecommunications Union and mobile providers to the 2018 Global Strategy on Digital Health. So I'm just going to briefly contextualize what we're dealing with in terms of achieving this transformation. And so on the next slide, the principles you see on the next slide, and John, if you may move to the next slide.
Yeah, it takes a second.
All right, so what I'm just going to describe on the next slide is the use cases that WHO is pursuing within the light of our global strategy on digital health. A number of you have participated in terms of promoting the global strategy, which was approved about 3 weeks ago at the 73rd World Health Assembly. This global strategy really sits on the 2018 resolution on digital health. With that came the promotion of the Department of Digital Health that is running the roundtables that Denis talked about. And so in terms of really focusing our transformation on digital, we're using the global strategy to support member states' abilities to utilize standards-based products, but while at the same time, the headquarters within the Department of Digital Health has produced at least 6 strategic areas of investments. The first item there that you see is a global strategy with its 4 objectives. Within the global strategy, what we're really thinking about is how do we orchestrate global collaboration coordination at a global level to ensure that we leave no entity or actors behind in the promotion of digital. And so we have been able to conduct a number of roundtables that Denis and others have participated along the first objective of the global strategy, which speaks to collaboration and coordination. So a number of roundtables have taken place. We had a roundtable on academia yesterday. There's a private sector roundtable that is taking place in January. But then beyond collaboration is the issue of skills transfer, which is really within the first objective of the global strategy. And what we're talking about there is that all these tools and products we're promoting must really find their place in the government machinery. And I'm really talking about both cognitive mastery of standards, for example, both semantic standards as well as technical standards. How do we ensure that governments, both the ICT sector and the health sector, are able to promote solutions that are interoperable in a way that is sustainable for the long run? Our second objective within the global strategy speaks towards the issue of making sure that we are focusing on people, and this is really being people-centric, making sure that we're people-centric and that we're ensuring that we're leaving no one behind. And then thirdly, we're busy speaking about within the third objective, we're really concerned about making sure that we are looking at frontier technologies such as artificial intelligence, blockchain, and making their way within the global strategy. And then lastly, the whole issue around strengthening regulation activities. Other areas, of course, of work that you see in the second bullet, which I'll go through very quickly, are around capacity building. And the notion of capacity building goes beyond having courses for digital health for strategists, tacticians, frontline health workers, and community staff. But how do we ensure that the producers of digital health have the appropriate techniques, mechanisms, and products to ensure that their solutions meet WHO guidelines? So we're really involved around capacity building within that context. We have produced a clearinghouse, which is a mechanism for countries to select products that have been curated and are standards based. We've also started a work around digitizing some of our guidelines. We call these smart guidelines. And what we mean here is that when WHO produces a guideline, normally it's in the form of a textbook. How do we ensure that we have APIs that can be ingested by software solutions more directly without having vendors look at the normative documents and then manually translate those into software packages? So our smart guidelines work is really quite transformative because it really looks to this next generation of digital products. Then the last 2 items you see there are use cases to do with innovation, managing, making sure that we're supporting ideation of innovation products, some of which might be more analog than digital, and also the question of supporting digitization of immunization products. Now, on the next slide, which is my final slide, actually, if you may go to the next slide, Joanne. So what you see on the next slide is the summary of the global strategy I just talked about. We have an investment case that is intended to support the 4 pillars in terms of what the cost implications would look like. And so we're really speaking about promotion of collaboration, advancement of national strategies, strengthening governance, and also advocating people-centered health services. We will be having a meeting with donors to sort of like look at the investment case in digital and how the global community can support the promotion of the global strategy. On the next slide, of course, is just a word of appeal. And if you may go to the next slide, John, there is actually a summary slide that really focuses on some of the products that we need to leverage to amplify. The products you see there are quite enormous. They include our recent digital implementation investment guide, which is, if you like, a toolkit that supports an implementer of digital health with a method of going from an idea of a digital implementation idea and then moving through the steps of implementation all the way up to monitoring the effectiveness of that implementation. So the guides are quite plenty, but just want to emphasize that we have some normative guides that we can look to utilize for the transformation. And the whole idea basically is to make sure that we're using digital to leave no one behind. So Joanna, let me end here with this short time that is allocated, but just to thank you for organizing this session and to thank all the speakers that have spoken before this particular presentation. Again, apologies for not being able to present at the time that you were expecting me to speak. Over to you, Joanna.
No problem. Thank you so much, Derek. That was very, very interesting and a lovely note here. We must ensure that digital health transformation is safe, sustainable, and leaves nobody behind. That is a great mantra for the work going forward. So at this point, so we have had all of our presentations today, and we have 10 to 15 minutes left to really discuss and agree our next steps and going forward. So thank you, Derek, for that great presentation, and thank all our speakers. So this is your workshop now. This is your opportunity. Everybody and anybody who wishes to speak is welcome to participate in the conversation regarding where we want to go forward and our next steps. From my perspective, I'm keen that we pick some areas of collaboration, leverage the the infrastructure, the vehicles that exist in TM Forum and in GIO. This is we've mentioned that in WHO they're very keen to build up the network of networks. So this can be another hub and spoke of that network of networks. Just another opportunity to connect with another audience and leverage the marketing and capabilities to drive communications of the great work that's going on. But in these kinds of activities, it's always good to have a technical aspect to underpin the work as well, so that the value towards scalable efficiency and interoperability and standards is also there. So I'd be keen that we understand how we could start to explore how we can build on these activities in the future. One area of exploration could be things like the standards of telecommunications, like the open APIs, the data models and information models, discussing in specific workshop type activities to explore how these potentially could be reused in the health sector, because there is a lot of good potential for that. So that's a collaborative activity that we could undertake. I'm going to pause here and just see if anyone would like to jump in with their thoughts about the priority areas for collaboration. Hi, Ping, would you like to say a couple of words?
So, Joanne, I think the presentation from Derek and Lucy is very good, and the interoperability between the healthcare sector and ICT or telco sector You mentioned about the data model and open API, such kind of things. So it's quite important and fundamental. And at the same time, I think for the healthcare sector, also need a new generation of the communication or ICT infrastructure with a new architecture pattern to embed into the healthcare system. Mm-hmm. As you mentioned about something like the 5G slicing, such kind of capability, and the fiber whole fiber network. So maybe we can discuss within this program, if for the next step, we can to have an architecture framework that the infrastructure layer in the telco, and then interworking with the healthcare infrastructure, seamlessly working together. And then based on such kind of infrastructure layers interoperability, then let the data flow and the information flow can build up such kind of trust framework, and more easily and more trusted, more securely be used in the healthcare sector. So
Hi,
that is about the data model in the, yeah.
Hi, Hoping. How you doing? It's good to hear your voice. Listen, on the mobile action on pandemics, you're hitting the nail on the head, and in terms of collaboration. So I would like to invite Ericsson and Huawei and Nokia to join mobile action on pandemics, plus all the operators. And I will follow up afterwards, after the call, in terms of invitations, if that's okay, because this pandemic means that we all have to work together.
Yes.
Exactly.
Yeah.
Very good point.
But within this program, I really have my suggestion that we can try our best. There are so many experts from different sectors, from healthcare sector and ICT communication sector, and we have the joint collaboration to draw out such kind of interoperability framework to let the both two sectors working together. Yeah.
Yeah, and you should know that actually Joanne and I had an extraordinary call on Friday evening with the inventor of the internet, Dr. Vinton Cerf, who is the chief internet evangelist of Google. And Joanne was quite shocked because Vinton, she thought he was just going to be polite, but he ripped me to pieces, as he usually does.
Okay. Oh, thanks, Denis. That's really good. I mean, it sounds like we've got a good basis for our collaboration going forward. And I think that's a great point with regards to having a, when we look at digital health from an architectural perspective, and we look at telecommunications from an architectural perspective, it's always very interesting when you look at an architecture from another perspective, because all of a sudden what was a big box to you becomes a tiny box in another person's architecture. So I think having some activity around understanding connectivity as a service, a harmonized infrastructure layer, would be a very, very useful activity. I think that's a good suggestion.
John, if I may, I think in thinking of what are the priorities, I would point to not just health and ICT, but also environment and what's happening in climate. And so our solutions, and there are ways to put health and environment and climate through some of these collaborations. Very often the things that are needed in climate action are good for people's health. So that's what I'm trying for taking that aspect. Thanks.
Okay, I'm sorry, James, but the audio was not very good there. I actually wasn't able to fully pick that up. Would you mind popping it in the chat window? So I'm just going to take a question here from Simon. In the NCD management, the medics will say it's mundane but important that reduces efficiency of healthcare systems. That is true, the operational efficiency, that is what we would advocate as well. How can the exciting digital technology interventions impact on the mundane patients who just need a blood pressure check or look at an ulcer, how know their COVID status? That's a great question, and I think I'll give my view and other people can chime in on their view on this. But I think when digital is efficient, it is the mundane that becomes incredibly efficient. That's why in telecommunications we've actually focused on operations management for many, many years to make the mundane as simplistic as possible, so that it almost it has the least amount of energy. It is completely automated as much as possible. So technology might seem, there's levels of technology. You want to have more energy on the exciting things, and in doing so, you need to automate and standardize and harmonize the more operational activities. That's kind of a mantra of at least Team Forum. It's what drives technology in a way. It's what drives certainly standards and interoperability. So I think bringing that into the healthcare space would certainly be a good idea. So just see if we have any other final comments from anyone. Otherwise, I think we're good to.
Yes. Can I add a comment? Yes. Good afternoon to everybody, and thank you for the great day. I have a comment and a suggestion. I think that about the data. We tried in COVID to work on tracking and tracing, and globally it was not a success during the COVID, of course, and globally it was not a success. So, to fragmentation, many problems were found about the different app used for tracing. Two reasons I mentioned. One is the privacy issue and the concern of people of using. But on the other side, also the fact that the health environment, at least in Italy, I see the experience in Italy where it failed. Also, the health community didn't use properly and manage properly the information that they have. So this is the first example that we have to take care about the important role of standard and interoperability. A question and a message for the future in terms of POC. If we wanted to work on this environment in perspective, I think that for COVID we have a great opportunity for a vaccine campaign. I think that this could be very, very important. There are very aspects like information to be shared to the people, how to manage the people that are real vaccinated, and I think that this is important also for allowing people to move forward from one country to the other. So if I can suggest, probably many of you involved are already considering this aspect, and so I'd like to know if it is already done something about this. But I think that this should be a very interesting opportunity about seeing what we can do as ICT enabler for helping these things that is going to happen very soon.
Thank you, Luigi. Would any of our speakers or participants like to comment on that? Okay. I think that's a good point, Luigi, and we certainly need to include that in the scope of our priorities and activities going forward. So at this stage, what I would like to do is ask everybody to turn on their videos, because we purposely had them off all along, and it was quite difficult because of the amount of people in so many different countries represented. We know we've got people in China, right across Europe, and right over as far as Trinidad and Tobago. So I think it'd be lovely if we could all just say hello to each other. Traditionally or ordinarily, we would all physically be together in one place. So it'd be nice for everybody just to say hello and actually to see each other. Hi guys.
Yeah.
Joanne probably want to
Hi, everyone. Yeah.
Hello. Keep safe and happy Christmas.
Yeah.
Yeah,
Yes,
happy
Christmas
Christmas.
is coming.
And New Year. And New Year.
Investments. Usually what happens that the investments are, as you know, very good.
Hey, congratulations to Joanne for pulling this off. A really great job, Joanne.
Here, here.
Yeah.
Excellent job.
Very
Thank
great
you, Wei.
session today. Yeah. Thank you, Joanne. Thank you, everyone. Yeah.
Thank you, Hai Ping. Thanks, everybody. I find it particularly interesting. Like when we're talking about bringing together two industries that have generally not worked together, you know, there's going to be many different things that are very different, like from language to culture to how we operate to how we think. You know, as an engineer, I think in a very particular way, and you know, as medics, you think in a very particular way. And what we need to do is basically break down those silos, right? And we've had those conversations with James. I see James nodding because every time he'd say something, I'd say it, you know, from how I see it as essentially as an engineer. So we are building bridges here, and that's what this is about. It's about building bridges, breaking down silos, getting to know each other, building trusted relationships, and it's upon that that we will be able to help solve the global problems of today. And yes, we want to like get to data models and APIs, and we want to build really cool applications, and we want to help solve the planet, but it really will be done by people. It'll be done by you guys. So getting together today on this session, giving your time, start building the relationships. You'll see each other's emails, start getting to know each other. We will hold more of these activities so that we build up the traction and the opportunity to work together more, and having a good quality methodology behind that is what will allow us to do it efficiently and scalable for everybody on the planet. And that's really what we're looking to do here. So I want to thank everybody, all of our speakers, everybody who helped with building up today's event. Really, really appreciate your time. Take care. We will be back to you with proposals and looking for you to engage in the future activities. So thank you so much.
Thank you, Joanne. Bye all. Bye.
Bye to all.
Bye.
Bye, Joanne. Bye, everyone.
Thank you.
Bye.
Bye-bye.
Bye, everyone. Yeah, bye-bye.
Bye.
Bye. Thank you.